to everybody. It gives me great pleasure today to welcome you all to Care and Support West virtual workshop covering CQC's new assessment framework. We're joined today by Paul Kay. Paul is the Business Development Director, Health and Care Quick Solutions, which is part of Citations. So without further ado, Paul, I'm going to hand the virtual floor to yourself. Okay, thank you.
Thank you very much, Karen, and good morning, everybody. I hope you're all well, and thank you for sparing the time to join me this morning. I'm getting a little bit of echo, so if everyone can make sure their microphones are off, that would certainly be helpful. It's not their microphone, well, they're muted. That's what I meant to say. So I'm going to share my screen. I'm going to obviously talk about the new CQC framework, which is something I would imagine is of particular interest to providers in the South because the CQC are prioritising this region for the trial of their new assessment framework. So yeah, I'm Paul, and as Karen said, I'm Business Development Director at Quick Solutions. In September of this year, we were acquired by Citation, who has a long-standing partnership with Care and Support West. Just a bit of background about who we are and what we do. We have over 600 care home and domiciliary care customers who use our CQC Pro software to prepare for CQC inspections. But we also work at all sorts of other levels across the NHS. So every ICS uses our software for continuing healthcare assurance. We work with over 180 NHS trusts in areas as varied as safeguarding, special educational needs, ISO compliance. So we're involved in all sorts of areas and echelons of the NHS, as well as in social care. So hopefully we're doing something right, because we have a great deal of coverage of use of our systems throughout health and social care. I wanted to talk about the assessment framework and share what I know, what we think we know. I think it's fair to say that CQC have not been particularly transparent about the new framework, and it seems to have been a slowly evolving situation where we've been drip-fed information. We were originally told last year that the new framework was going to be introduced, only for CQC to roll it all back. And here we are, more than a year later than when they originally said the framework was going to be introduced, because I think they've been trying to backfill with information that just wasn't available, that was really necessary to qualify and quantify really what they mean in their new framework. I think the most striking feature of the framework, and as it says, it's a single assessment framework, so it's one framework for all services, as opposed to what we've all been used to with the KLOEs, the key lines of inquiry, as part of their fundamental standards, where there was specific guidance for every different provider type and different versions of the KLOEs for different providers. We have now one size that fits all. We still have the 5 key questions: safe, effective, caring, responsive, and well led. And the KLOEs, the key lines of inquiry, become quality statements or WE statements. So these were something that came out of something called Think Local Act Personal, which was an initiative really designed around service users and their requirements, and something called I statements. So I, as somebody using services, would expect a certain level of support. And then a derivative of those is the we statements, which is, as providers, this is what we would seek to provide as a level of support and quality of service. So the quality statements, or we statements as they're also known, are the replacements for the KLOEs, and new assessment teams have been created within CQC to support services based on a much more sort of evidence-based and data-led risk analysis of what where providers are up to. So a sort of different expectation in terms of inspection frequency compared with what you might have been used to. So this is a CQC slide, but just to sort of summarize some of those things. We're going from one framework, multiple frameworks to one framework. You have ongoing assessment of quality and risks led by data and evidence gathered rather than through just the inspection, evidence gathered on an ongoing basis. So through the portal, providers being invited to upload evidence of things they're doing and notifications and key performance indicators, but also taking into account things like the views of commissioners, Health Watch, the views of people who fill in surveys on CQC website and other feedback mechanisms, taking a wide view and a sort of watching role from CQC to see if there's something that concerns them, either in the data or the evidence that they come across, which may then trigger, a call from the inspection team or an inspection in itself if there are concerns. Obviously, with the previous inspection ratings, there were long reports created by the inspection teams that took a while to arrive and took a while if you wanted to challenge them. Whereas with the new framework, there will be scores attached around evidence categories, which if you're not on mute, can I just ask you to mute yourselves so you don't come through on the over the presentation. So I was just saying the judgments and ratings characteristics are now moving to a new mechanism where your evidence categories will be stored. So by scoring how you do against each of the quality statements against numerous evidence categories, which we'll come on to, an overall score will be made, which is designed to give the public an instant view of where you sit amongst your peers, amongst other providers, and to try and make it clear, to help them select the right provider, which is reflecting, the level of performance that they are delivering. And a more dynamic rating system whereby if things change, there are opportunities for you to upload new information and hopefully affect your score and to have a more sort of dynamic approach as opposed to waiting for the next inspection, which might be potentially years away and no opportunity for you to move within the ratings. The actual ratings themselves still remain the same, so you still have outstanding, good, requires improvement, inadequate. But as you can see, the scoring mechanisms, and as we'll explore a bit further now, are going to change accordingly. Here's an example of an I statement where we're seeing things from two perspectives. So we're seeing things from the perspective of the service user. When I move between services, I can see that there's a clear plan and it should run smoothly. And from the provider perspective, we work to deliver that for our service user so that they have, a clear movement between one service and another. So I've got a slide here which details some of the quality statements, in fact, all of the quality statements in relation to SAFE. And in many cases, the quality statement is very similar to the key line of inquiry because, as you could quite understand, there are things that have always been a requirement to provide safe care, like safeguarding, like safe medication, like infection control, medicines management. So those things all appear. There are slightly more quality statements than there were key lines of inquiry because some of the things that might have been covered in one key line of inquiry have been split out and you have more quality statements as a result. I think there were 26 key lines of inquiry. There are now 34 quality statements, so slightly more. And as you can see, they are still covering the same areas. And I think what's most important is they are still covering the same regulations. So the regulations are unchanged. They still remain They haven't changed, and if the CQC were to take action against a provider, the regulations that they cite are still the same. So be aware of what the regulations say, and if you are concerned, then the regulations are obviously a place to go to see what your minimum requirement should be in any particular area. There is a new concept with the new assessment framework, which is evidence categories. So underneath each of the quality statements, there are 6 specific evidence categories. Now, we spotted something on CQC's website, which is worth knowing. According to their website, people's experience of health and care services and feedback from staff and leaders are 2 evidence categories they will look at for every single quality statement. The reality is that they don't always apply to every quality statement when you dig down to it. So their website is actually wrong, and I've been in contact with CQC who acknowledge that. So the evidence categories appear in varying quantities and in varying numbers to each of the quality statements. So some apply to one or many of the quality statements, others don't apply. So if you look at the guidance on the CQC website in detail, you'll see which evidence categories you need to be aware of for each different quality statement. And they are quite obvious when you read the quality statement that some of them it just isn't appropriate for that particular evidence category for that quality statement. So there are 6 different evidence categories where you can start to build a picture and benchmark your service in advance of the CQC carrying out their scoring. And the better quality of evidence that you can have at your disposal, you can share with CQC, the better the other people view your service in terms of the people using it, all the other stakeholders, and others like Healthwatch and commissioners who may be involved, local authorities, and feeding back their views of your service. That will all help contribute to getting a positive score. So being aware of the evidence categories for each of the quality statements will be really useful and help you prepare. In terms of the scoring, it's going to be fairly straightforward. As it says on this slide here, there will be a rating from 1 to 4, depending on the quality of evidence being provided and the quality of care and service and performance in a particular area. And in this example, we've taken the SAFE key question. There are 8 quality statements giving a total theoretical score of 32. So that would be a maximum of 4 points per quality statement. So if you add up the various scores, you come to a total of, say in this example, 21 out of 32, which would give you a percentage score for the key question of 65, 66%. And they will be publishing thresholds, so you know where that would put you in line with other providers. So in this example, 65% would equate to a good rating, although you will be at the lower end of good because providers anywhere up to 87% could still be good. So it will give you a view of you're a good or a bad good potentially, but somewhere within that good range. And that will be presented on the portal in a graphical format, something like this, where you will be somebody looking at you as a provider would be able to see what your score looks like, where that sits in the range of inadequate to outstanding, and obviously where it sits within that grouping of, say, requires improvement. So it will give hopefully the public and anyone interested in your service a quick view. And obviously I think it goes without saying that the better you can score, the better the prospects will be for your care organization in terms of attracting new clients, and obviously the way you are viewed by commissioners and other people who may be interested in your service. So that's how it's all been described is going to work as far as we understand it. In practice, we'll have to wait and see, because obviously the trials of this new framework are just beginning. The portal is very much in its infancy, and I think it only becomes meaningful when you've managed to have data across all of the different providers. So if you have only got round to collecting data on behalf of 20% of care homes, you're not going to get an accurate representation of where you fit in as a percentage of all care homes in England. So it comes with, I think, quite a few caveats, and we're going to have to wait and see how that works in practice. I'm also concerned because there are supposed to be about 100 inspection teams covering the entirety of health and social care. So whether they will have the capacity to carry out targeted inspections as they need to across all of those different service types, again, we'll have to wait and see. But CQC are pressing ahead with this now, so I think all we can do is be prepared, and then we'll wait and see what happens in practice. The portal itself has been designed really to make notifications easier, and as a conduit, as a way of exchanging information with the assessment teams that hopefully improve your chances of getting a better score. So it's an opportunity for you to upload evidence as well as just statutory notifications that you might have to provide to CQC on an ongoing basis. And we've already seen some providers during the trials who've been invited by their inspection teams to submit information to help them sort of understand where the service is up to and what their priorities are. So expect to see more information about the provider portal, and I think familiarize yourself with it and make sure you use it to its maximum effect. So if you've got really good evidence that you want to share with CQC, then there should be a way of uploading that through the portal, and that would gain visibility and potentially, as I say, affect your scoring going forwards. So everything we've been talking about, or I've been talking about and describing, may be slightly confusing and perplexing or even worrying, and Quick Solutions for many years has been all about helping people using technology to prepare and be ahead of the game as far as CQC compliance and CQC inspections are concerned. So we have something called CQC Pro, and CQC Pro is an online system, something you can log into through the internet that you can use to prepare everything you might need for your own ongoing quality assurance. And quality assurance is an area that CQC inspectors frequently call up providers about. Most breaches are around quality assurance, and providers who are not aware of issues that they should be in their care services. So it's about being able to monitor and manage your quality assurance, to provide evidence, and also, if the evidence is that you're not compliant, to create action plans. So I've identified an issue, I'm going to do something about it, here's my action plan, and to be able to report and to be reminded and to have visibility of the health and compliance position of your service at any time. And it's not just a one-sided self-assessment, it's also really important to take into account the views of others. So we have a peer review function, we have surveys that come with the system, we have KPI checklists, so you can see what the data is telling you, and the ability to report in real time of the position. So when the CQC turn up, you have all the information you need. And we have this platform developed for single homes, single dom care organizations, or groups, and we have oversight and all sorts of additional tools for care groups so that they can see what's going on at an instance and compare and contrast and share information across a group. So CQC Pro is something I wanted to introduce to you today as a potential easy way of understanding and preparing for this new assessment framework. It includes all the quality statements, still includes all the regulations, but we've had specific content that we feel fills some of the gaps left by CQC in their guidance that we feel will be really useful for people to help them understand what they need to focus on and to provide the best possible evidence to increase their chances of getting the best rating that they can. We're also introducing a new scoring mechanism so that as you rate yourselves as a self-assessment, the scoring that you give yourself mirrors the CQC scoring mechanism, so you can get a rough guide to how you see your score appearing. I'm not guaranteeing that you'll score yourselves the same way CQC will, but to give yourselves some ideas based on your experience and criteria, how you're performing in a similar way to the way CQC will judge you. So I wanted to share that with you and give you a quick run through of what this system looks like and how it might help. And as we go, if you have any questions, please put them in the chat, and then I'll be happy to take those on any aspects of the CQC stuff I've talked about, or indeed about CQC Pro. So I've logged in. This is the dashboard to CQC Pro. The 5 key questions, 1, 2, 3, 4, 5, safe, effective, caring. This grid is telling me how much evidence we currently have and how we rate ourselves in each of those areas. So the scoring will be applied to that very shortly, so that you have that as a percentage score, so you can see overall how you're scoring in each of those areas. But initially, I would be interested, I think, as a provider, to look at the quality statements to see how I compare and how my service might be delivering against those quality statements. So to that end, if I click on the grid or the table here, CQC Pro will take me to the quality statements, or it would if I hadn't logged in, or if I'd logged in more regularly and hadn't logged me out because I timed out. My apologies there. I will log in again, and the system will hopefully resume where I was. Just wait for the internet. Here we go. So under the 5 key questions, I need to just switch to the right site, which would also help. Once you are logged in, and because I'm on Teams, this is just taking a little moment. Here we go. I'm going to click on Safe as I did just now, and you can see within Safe, we have the key question here, the definition of the key question, and then the various quality statements. So you can see where I've been before, because we have some colors, some RAG ratings that I've applied. In this case, I'm going to pick a question that we haven't looked at before, which is involving people to manage risks. So we work with people to manage risks. And this, just so you're clear, is the care home version. There are also versions for home care organizations, dom care organizations, and other service types who have their own specific information attached to them. So as I click on the quality statement, we've presented the I statement, so you can see how that looks from the perspective of the person in care, and also what the quality statement means. This is CQC's guidance that they publish on their website that we've presented, we hope, in a straightforward manner. But from your perspective, if you click on this little icon here, to get to this screen is where you need to be to start to build evidence to show how you comply or otherwise with this particular quality statement. So at this point, the key thing here is we work with people to understand and manage risks. So what do we do? How do we do that, in a safe and effective manner? And really, what should we be doing here? So to help you, we have the assistant. Now the assistant will detail the evidence categories which are relevant for that key line of for that quality statement. Oops, nearly said key line of inquiry by mistake. So the people's experience of health and care services is one of the CQC's evidence categories, as is feedback from staff and leaders. In blue is the guidance that the CQC give. In black beneath that, things you think about is specific content we had written for us by a recently retired CQC inspector who really knows her stuff in this area and has tried to spell out very clearly the things that you need to be considering in relation to this particular quality statement. So there's lots of really useful information and guidance, more than the CQC, who is saying, oh, we'll be observing equipment. In here we are going to be breaking that down and what that actually means. The equipment is used safely and meets the needs of the people it's used with. We also have the further information, which restates those I statements, what the quality statement means, and subtopics that are relevant. And we also have the regulations. So if I'm interested in the regulation relating to person-centered care, I can just go straight there. I can have that open in my browser, and I can flick between it as I build my evidence statement. So what we're looking for is an honest assessment of you as a provider, of where you think, from your position, your experience, where you think you stand as an organization in relation to managing a risk. Do you support people to do that, but do you do it in a safe way? And for me, I think it's not just having the right policies and procedures and training and things, but it's also an opportunity for you to talk about outcomes and the way that things work in practice in relation to the way you meet that standard. So you might have a clear understanding of risk, but what does that actually translate to in the real world? Can you tell stories that you can share with CQC of the way you've supported people, you've enabled them to do things that they wouldn't otherwise have been able to do because you took a very balanced view of risk, and you were able to understand that and provide a better experience for a particular service user. So you can create one or multiple evidence statements. You might be talking about your, as I say, your training that you might have in this area. You might talk about the ethos of culture of your organization, but you might also be talking about specific examples that you could share with the CQC as and when they come calling. The system has a document management system. I can attach any relevant document that I've already uploaded, and it will organize them by key questions. So if it's a safe document, it will list all the documents which we think are relevant for safe. Or I can click this attachments option here and take a picture. Any sort of evidence, could be a copy of a policy or procedure, anything that you think supports the statement that you've made. And finally, because this is about being continually compliant, I can set a reminder date, and CQC Pro will remind me in 2 months, 3 months, 6 months, whatever, when I'm not so busy and when I'm ready to look at this again, and to make sure that things may have changed. So I might have a new story to tell, or we might have had different staffing arrangements in the intervening period. Anything can happen. So keep reminding yourself to review your evidence, and CQC Pro will email you on that date to review it. CQC Pro also allows multiple people to input at the same time. So you could have one or multiple owners for the evidence. So the person who owns it is the one who gets the reminder. So this system will help manage your time and provide a framework so that you can start to build that picture of compliance. And then on demand, when you need it, you can go back to that evidence, and if you're asked about it, you can provide a real-time view. So I've answered the question. I'm going to say we're good in this area. You can use the RAG rating to select any color. If it's not green, then it could be anything from inadequate, which would be the red color. So I'm building the picture, and it works the same way for each of the quality statements. Just click on this little magnifying glass icon a couple of times to get to the new evidence, and off you go. You can write a new evidence statement, go to the assistant for that particular question, and look at the guidance that's there. As well as being reminded by email when a particular quality statement is due for review or evidence is due for a review, every time a user logs on to CQC Pro, it presents them with their tasks. So the things here are either becoming due or overdue. I can just click on from here and it'll go straight there. So once you've gone through the process of uploading evidence, it's just a question of waiting for your reminders and then updating things. Or if things haven't changed, you could say, well, that's still fine. Remind me again in 6 months' time. Obviously, if something's urgent, I want to respond to it more urgently, then I can select a date, any date I like. So you're in charge. It's your system, your data. You decide the frequency you want to review your evidence in line with other things that are going on, with your other workload that you have. So as I'm building that evidence picture, CQC Pro can also generate summary reports. So if I want a summary of the evidence in SAFE, I can just click here and I can see that evidence. I can even edit it from here if I see something I need to change. The one we just did was this one here. I can look at any attachments, I can open them and see them. And if I want to, I could export that or print it or create as PDF. So I can take the information off the system to share with others if needs be. We've even had some instances, we've done some trials with other providers who've allowed access to the inspectors to this system so they can see the evidence. Now that obviously depends on a number of factors, including the willingness of the inspector to see the information this way, but we can make it available as a read-only format so they can see, because it's laid out in a way the CQC understand. It's something that they can quickly get their heads around. So my evidence is we are or aren't compliant. You can see in this particular area we've got one question where the evidence was that there might be an issue. We've said that, okay, there's an issue with MAR charts. As you can see here, there's a tab which says action plans. So I can create action plans to capture the things I need to do, and action plans can involve multiple people. So I can say I'd like multiple users to be involved in the plan. So the owner has responsibility for the plan, but I might have a senior carer or deputy manager or somebody else involved in the plan. And I capture the details of what needs to happen. I can put in as much information I need to in my action plan. And when I'm happy with that plan, I can use this progress bar to show how far we're progressing through it, as can everyone who's involved in the plan. So if there's people who've been applied to the plan as users, each user will get their own reminders and updates to update the plan. And I publish that plan, and that also generates email reminders and will also appear on that task list on the home screen. So I've got the mechanism here for self-assessing my compliance, for managing action plans, and a framework with all of the content that I need. And on top of that, if I go to my resources here, you'll see that there are all sorts of other resources, including best practice guidance that CQC Pro has. So for each of the quality statements, there are the regulations, but also best practice guidance with other links that you can click on, and other web pages and resources that are relevant to that particular question. We also have links to websites and other information here, with the latest guidance from CQC. This is regularly updated, COVID guidance, skills for care guidance and things. So if you want to use it as a learning tool and a resource, there's loads and loads of information here available, including guidance on the evidence categories. We also have specific guidebook that comes with the system, with overviews of changes from both care home and home care perspective, and what that means in practice. So CQC Pro will help you manage your and prepare for a CQC inspection against the new framework. It also enables you to gather other feedback so you have control. So we provide a number of different templates, both surveys and audits, where you can start to collect information from people involved, people using services perhaps, or maybe your staff or visiting professionals or relatives and friends. There are templates for all of those, and they're really easy to use and to send out to people. If you know their email address, you can literally just copy and paste a list of email addresses in here, and it will send an invite to them to fill them in, typically on a smartphone. But you can share the link on your website. You can put it in your own email. You can create a QR code so you can have it sitting within a care home environment for people to scan on their phones. Or you can print a hard copy and ask people to fill it in on paper. So in this example, if I was filling in the staff survey, and although this looks like a big screen on a iPhone or Android phone, it will resize to the device so it looks really smart on those devices. And people have the opportunity of telling you what they think, adding comments, confirming they're not a robot. Oh, it's asking me to confirm images with bridges. That's keeping me alert at this particular moment. I think is that a bridge? Might be or might not be. And you submit. So somebody's filled in the survey. What CQC Pro will do is notify you that a new survey has been received. You can then view the responses you've had. You can look at them. You can even create action plans from that survey. So I can create an action plan, or I can review it and add notes. So if people are saying something that I need to be aware of, I can quickly have access to those survey results, and I click a button and it will collate those results and present them back to me. So rather than waiting for CQC to tell you that they've had some negative feedback potentially, or really good feedback that you need to know about, this system gives you control. You're collecting your own feedback from people, and you're able to respond accordingly. You can use it as evidence, supporting the quality statements. You can also use it to drive actions where you might then do a further investigation if people feel that their answers, or your service is lacking in a particular area based on the answers they're giving. And you can also use it as a very powerful before and after tool. So you can filter the survey responses over a particular date range. So I can say, show me the results between November and December, say, and it will give me the list of those results between those dates, and I can compare what they look like compared with the results from an earlier time. Maybe we had an issue, we changed something, and then you get a much more favorable survey response because you've introduced something new to your menu. You've got a new activity, you've got a new way of doing something. You've relaid out the residence lounge in your care home. Whatever it might be, you can run those surveys whenever you want, very easily, very quickly, and choose innovative ways to have them completed, depending on your setting and the capabilities of people you're asking the questions of. So really useful tool. We also have something called the oversight dashboard. So a way of collecting on an ongoing basis weekly and monthly data, and there are different versions again for home care organizations compared with residential organizations. Here's an example on the weekly KPIs. So let's say I'm filling in for this week, how many of these have we, how many people have, how many hours rather on the shift have we, do we require, how much use of agency staff. So this is just an example of the sort of information that you can collect through the system. I'm going to just put in some answers I say previously just to save a bit of time. And this can also be tweaked and changed. So, this is our suggested template, but there is the ability both with surveys and with these audits to create your own versions and ask your own questions. And if you collect this information, CQC Pro will then present it back to you in a nice, easy to digest format. So on your home screen, under these other tabs, the information you've been putting on these forms is presented back, so you can start to see instantly if data that you're collecting is revealing certain trends. If you got, oh, we've got an issue with MAR charts. We were just talking about that in the quality statement. So why is there such a high degree of MAR charts not being updated? Look at the reasons for that, and then when you run your report in future months, hopefully those big spikes will be going down as you find you've addressed the causes of that, and you've started to reduce the numbers. Deals with things like safeguarding. These are the monthly reports. It's entirely up to you as a user how much information you want to put in and whether you wanted to use this. But I would say if you want to have control and visibility of the performance of your service, having these sorts of capabilities, I think are really good. Really useful for owners of care businesses to see how the service appears to be performing, compliments, complaints, surveys and feedbacks, and those weekly KPIs. What our occupancy levels might be, or what our shift hours might be in this particular case. So it does an awful lot. The system comes with a support desk and training and help videos. If you are a care group, there are different overviews and different functions, so you can actually drive things from the center. So a care manager at a care group can specify particular areas that they want to be filled in by the homes within their group. They can also share documents across the group, policies and procedures, set reminders and alerts when documents need to be reviewed, all sorts of other things that we'd be very happy to go into in more detail with people on a one-to-one basis. So that's a whistle-stop tour of CQC Pro, the key features. It's a very low-cost system, other than the license fee that is payable on an ongoing basis. It costs from just £70 a month for a 5-user license for CQC Pro, with all of the things I've just shown you. I hope you agree it's looks intuitive, it's easy to use, but we provide free training. You can log on to free training on the evidence side, and also on the surveys. It happens multiple times a week. You can log on to the training as you need to, and it will help you get your heads around this new assessment framework and be prepared for your own benefit. And then when CQC come, hopefully you'll have all the answers that they need. So I'm going to now invite questions. I will ask you, Karen, if there are any things in the chat that I need to respond to. Yeah. I think one of the questions was on the cost. I could just see that one from David. So it's £70 plus VAT per month for a 5-user license for a single home. If you have multiple homes in the group, then there is a reduced rate for the system for the more homes that you have. So we'd be happy to provide quotations for that. If you're a citation customer, they can be bundled in with your citation services. So you might have things like health and safety or employment law services from citation already. CQC Pro can be supplied as part of that. If you're not a citation customer, then you can buy it as a standalone product and talk to us about how what you would need and how that might work for you.
Thank you, Paul. As you can see, David's actually asked if there's VAT included as well.
Oh, I wish. Unfortunately, it's plus VAT. I'm sorry.
Okay. Okay. That brilliant. I think from the responses, everybody wants a recording of it, because everybody's noticed how brilliant it is. It's amazing amount of caption that you can have for your homes. One thing that went through my mind is, have you shared this with CQC? Do they know that you've got this tool?
That's a very good question. I have various interactions with CQC. On one hand, there are individuals in CQC who are very much aware of it, who've seen the tool, who really liked it. And we set up some, a couple of years ago, actually, we set up some evaluations with CQC. The downside of CQC is because they're a public organisation, they can't be seen to recommend one private provider over another. And there are other systems available. People might be familiar with, other CQC compliance tools. It's become more popular now. So for them to recommend one over another is something that's difficult. However, what I will say, Karen, is I presented it at various other webinars, care associations, various care groups, both nationally and locally, and universally. I think it's been really well received. I think there is definitely a need for this, and we seem to be a little bit ahead of the game in terms of being able to present something that's actually got all of the content for the new assessment framework. So we've been really beavering away the last 3 or 4 months to make sure we have something that's ready for market. And I think we're certainly ahead of the game with compared with our competition.
It definitely is a quality program. There are a couple of hands. David's got his hand up first, and then Alethea second. So, David, would you like to ask your question?
Yeah, just a quick question, Paul. Really to be saying, be useful for you and I to have a conversation offline, because I'd like to have some discussions with you about how Care and Support West can work with you in relation to its members. There's obviously a distinction between people who are members and who are not members of Care and Support West, but I'd like to have an offline conversation with you. So give me a shout when you've got a time to do that. Thank you.
I'd be very happy to. And if I haven't made it clear, that there is free training available. We have training webinars that you can just book through our website. All existing customers can go on training repeatedly if they need to. And we have a help desk with real people, so you can speak to a person rather than a robot.
Thank you. Alethea?
Hi, yeah, lovely. I was just going to ask around the CQC portal and how your system's going to link in terms of uploading that data onto that portal. I'm assuming that's something that you're looking at to make that an easy process, so you're not doing the same thing twice.
Unfortunately, we're in the hands of CQC a little bit there, because without the necessary tools from their end to receive an electronic upload, things are a bit difficult. So we have actually raised with CQC the potential for us to upload information from our system directly to them. You'd love to just press a button and go, there's all my CQC reports straight delivered to the CQC. Right now, the quickest way would be to create the summary report, which has all of the evidence, save it as a PDF, and through the portal you can attach it as a single document and upload it. If and when CQC ever get their act together, and they haven't got a great track record with tech, I'm afraid, but as you'll know from things like the PIR in the past, where they didn't exactly get it right first time, then as and when they have that capability, we have what we call APIs, the ability to squirt data to other systems. So yeah, watch this space, but we'll do as much as we're allowed to do or able to do as far as CQC is concerned.
Lovely, thank you.
Thank you, Paul. You mentioned users. So if I, for example, was a single entity and I had an account with you, would there only one person have access to that account, or would you be able to have it available for, say, your deputy or director of the organisation? Does that?
So you would have up to 5 users that you could have within the organisation who could all have simultaneous access, and then if you need more, then you can buy them. I think it's about £10 a month for an additional user license, or you can buy them in groups of 5 or 10, and it's even cheaper than that.
That's useful to know. Thank you. Okay. Are there any more questions? There's nothing in the chat at the moment, but does anybody have a burning question you'd like to either raise your hand or put into the chat? Don't think there are. Alethea's got another one.
Yeah, I didn't even put my hand up. My apologies.
No, we'll let you off, David.
people know me very well for that. I think, Paul, one of the bits of the conversation that I would like to have with you is, as you know, we hold an annual conference, and the one in 24 is in June. And I'm minded. Karen and I are talking about that tomorrow or sometime this week. But I'm minded to be wondering about an element of that conference to cover this, because this is so significant in terms of providers and how to not fall foul of all the newness, and some of it looks new and some of it isn't new, but it's got a different name. So it would be useful to do that. So I'm just letting you know that, but also the provider group that's on this call, just to let them know that that's something that we in Care and Support West are thinking about.
Well, it's in my diary, David, so I will be at your disposal. I'd love to be part of the conference. So yeah, we'll talk more after today and
yeah,
make
that'll
some
be
plans.
great.
Well done, Paul.
Good.
Thank you.
Thank you.
Alicia, you have a question?
I do. Sorry, yeah, just following on from that newness of it all. So I was looking at you linking to all the reference guides. So how frequently are those being reviewed and updated, just to make sure that it is the latest stuff that's coming out that people are then referring to and referencing?
Well, we actually got caught out a couple of weeks ago because we realised CQC had changed something without telling everybody. We looked at the content we had, and then we looked at what was on the website, and that's changed. That's interesting. So we're looking at it all the time, and we update CQC Pro potentially on a monthly basis if there's new guidance. So yeah, it's something we have to be aware of because it's a moving target.
Thank you. Georgie has said she missed the price, or he missed the price of the CQC Pro. Do you want to reiterate it, Paul?
So yeah, just to repeat, it was £70 plus VAT per month for a 5-user license. There is a minimum contract of 12 months, so your commitment in the first year would be effectively 12 times £70. We can take payment by direct debit or annually in advance, so whatever people prefer. If it helps by spreading the payment on direct debit, that might appeal to some people. And obviously with multi-sites, then there's discounts available.
Excellent. Thank you. Well, if there's no more questions, it just leaves me to say thank you.
I've just put my email address in the chat.
All right. Okay. That's
Sorry,
good.
Karen.
Yeah. No,
Yeah.
it's okay.
So if people want to contact me, there's my email address in the chat. I'd be happy to talk to anybody on a one-to-one basis. And I'd also, before you go, if possible, if people can just say whether today was useful and informative, and if it was, from your perspective, a good presentation or not, that would be really useful to know.
Paul, I was going to say, judging by the number of people that have asked for recordings, I think people have enjoyed the presentation and find it very, very useful. So it's a product that will clearly help social care providers throughout the year. It actually went through my mind that by completing this, you're actually doing CQC out of a job, because actually you've got all the information there. It'll make the CQC presentation or the visit quite sort of simplified, I would have thought, by having all the information there. So, and it really keeps everybody on their toes. So well done. Thank you. Okay, everybody, it's really great to have so many people stay, and we had 33 attending, so which is really good. But as I say, the recording will be put onto Care and Support West website, and I'm going to stop recording now.